Thank you so much, Arun sir, for joining us on a podcast at Dawdle. Extremely grateful that you took out time on this holiday and joined us to share your valuable experiences with our global audience, which is growing by leaps and bounds every day. Thank you again, sir.
Thank you, Rishi, for giving me opportunity to use this platform to share my thoughts on the healthcare. I'm BITS Pilani, IT grad, and did my management degree from IIM Calcutta. I started my career with the government in Doordarshan. I was engineer there. From there, I switched my career to Central Bureau of Investigation after selecting through UPSC into the Central Bureau of Investigation. I was heading the systems division of CBI. And I initiated the computerization in Central Bureau of Investigation, where I was responsible for integrating and computerizing all 70 branches of the Central Bureau of Investigation. During my career, we computerized all the registered cases of the CBI into the digital system. We created the application in 3 parts. One was the investigation, middle part was the prosecution sanction, and the last part was the trial, through which we were able to evaluate the number of investigations, the age of the investigations, age of the trials, and management got enabled using these analytics to dispose of cases in the faster way. So that's how I contributed into the CBI. We created first cyber forensic lab into Central Bureau of Investigation headquarters based out of Delhi also. After completing the 20 years of service in government, I took the voluntary retirement and switched into the corporate. I joined healthcare, one of the top diagnostic company out of US as a director IT. Then thereafter, I rose up to the operational leader, and then later on, I switched to the business in the hospital. I led 2-3 hospitals, including Paras Hospital, where I ran the hospital from the business side, HCG Oncology Hospital. HCG Oncology Hospitals bought one diagnostic chain called Strand Life Sciences, which was a genomics lab. I ran that particular lab also as a president. Thereafter, I switched my career to another MNC called IQVIA, where we won and create the National Digital Health Mission, where I was posted as a director of projects to create this National Digital Health Mission, which later on renamed as the Ayushman Bharat Digital Mission. So we not only created the blueprint for the National Digital Health Mission, we rolled out into all the union territories and implemented in all the government-run hospital NDHM successfully, and 100% implementation were achieved during the career. Later on, it was rolled out and given to the another party to run it, to implement it all across India. Then I switched over to the Sir Ganga Ram Hospital, where I'm responsible for the digital initiatives as a director IT. So this is my career journey.
This is very prolific, sir. And sir, just one question out of the context is that how difficult was it to digitalize an organization like CBI
So
when you started it?
this question have been kept on asking by the respective people all through my journey. But I feel more comfortable in the corporate than the CBI. CBI was more structured and more pressureful work than the corporate. In CBI, we used to work 24/7, and we had a lot of pressures. And during my tenure into the CBI, the cybercrime was growing. That time, the cybercrime input was not that much into the conventional crime, but we were putting our efforts, and we cracked many cases and helped core investigation team to crack many critical conventional criminal cases in CBI.
Sir, we'll come back to the hospital IT transformation because, you have led major hospital IT transformations in your career, from HIS to ERP integrations to EMR rollouts. What do you see the biggest technology gaps which hospitals in India still face today?
If you see digital journey into the hospital, into the healthcare, there are 3 parts to the healthcare, particularly in the hospital. One is the public hospitals, another is the private hospital, and third category is the corporate hospital, I would say. So far as the corporate hospitals are concerned, corporate hospitals have adopted the technology very sooner and at a very early stage. And I see all the corporate hospitals are well equipped with their digital journey. And all across digitization has been implemented in the corporate hospital, if you consider that particular aspect. The second bucket is the rest of the private hospital. The digital adoption has been slower there because of their nature of working and having a lesser inclination toward the digitization. than clinical practices. And public is the government hospitals, the adoption is further slower. NDHM and NHA's initiative and other government initiatives, a little bit in adoption is happening there in the public sector, but way ahead to go. And still, a lot of digitization had to happen into the public sector per se. So this is what is the three buckets I would say. But so far as the Indian healthcare system, or in particularly if we speak about the hospitals, the digital journey has achieved its digital journey very well, where they have implemented digitization all across, be it the laboratory, the diagnostic testing, be it the radiology testing, be it the conventional hospital information system, the HIS, etc. Furthermore, the backend application, be it the ERP, EMR, etc. So those applications have been adapted into the hospital journey these days. But so far as the operational requirement is concerned these days, every healthcare service provider is dependent on the digitization in a big way or a small way. So there is no way they can get away of digitization. They have to adapt it. This has become a compulsion sort of it.
And sir, also talking about implementing EMRs and AI-based scan to text solutions, especially for clinical documentation. What are the practical challenges of driving clinical, clinician adoption of these technologies?
If you ask me that scan to text AI-based technology adoption for implementation of the EMR, I would say that this is the latest technology which has come up across as an option to implement the EMR. Earlier, the EMR adoption have been, be it in the NHS or across the globe, go anywhere, be it into US or Singapore. I have read and studied all the healthcare systems out there, where conventional practice has been adopted by using the conventional data entry, using the keyboards to enter the clinical data into the EMRs. So that was the first step when EMR adoption started. Later on, when people found it difficult, I would say mostly the clinical people and the clinicians found it difficult and hindrance to provide the clinical outcome to the patient to fill the EMRs using the keyboard. So they started using the sound to text options, and they used SoundX based application to fulfill the EMR data into the systems. But that was also not that much perfect, and many clinical and medical challenges came out, and the conversion was not 100%. So people were not that much adopted it and were not used to of adopting this technology and found difficult to practice it. Then digital PAN, prescription came in, and those were also explored, but those also got failed, and that technology was expensive as well, because every prescription required a digital prescription using the digital PAN. Of late, we found this technology where we found, and particularly my take on any technology adoption is that when you implement any technology based upon the user's behavior, and user need not to change his behavior, then technology adoption become easier, and you feel you get more outcome out of it. So in this technology, what we did, we told our clinician not to change their behavior. They keep on writing on their prescription on the pen and paper. We put a small scanner overhead, which was covering 6 by 6 span of the table, where clinician was writing on the piece of paper. On click of button, this particular prescription was getting scanned and getting converted into the digital format. We integrated this particular scanner with our HIS on the back end. So this scanned data, digital data, the converted data was getting seated into the HIS. So in the subsequent consultation, just by putting the UHID, we could pull out the digital format of the patient record, previous patient record. And thereafter, you can just edit it on the screen, and you need not to even scan any further handwritten prescription. If you need, you can do it, but subsequent consultations were not requiring those scanning. Furthermore, just to cover the medico-legal aspect of it, we attached this scanned copy of the original prescription to the digital format, so that if there is any confusion to the patient or there any other clinician whom they are having a second opinion, they can refer to this original prescription to confirm the any prescription of medicine or a test or anything, any advices, etc., from the original if there is any confusion. But so far, we achieved the 100% conversion in the scan to text. The only challenge initially we faced was the slower conversion of the through the AI. When we were scanning, it was getting converted into 3 to 4 minutes, which was a little bit cumbersome. Where we had to wait for 3-4 minutes to get it receive the converted copy into the system or to the patient, because we are sending the same digital copy in WhatsApp to the patient, attaching the original prescription as well.
And sir, you have played a leadership role in this national digital health mission as well. So in your view, what are the most critical enablers of building a unified, interoperable digital
So,
health
see,
ecosystem in
while
India?
developing the National Digital Health Mission, we kept in mind, we created a federated architecture where, we kept in mind that all the hospitals and all the hospital service providers, they are the owner of their data, and they need not to share their data with anybody else, and they are the owner of the data. There is a misconception and fear across the service provider even today, that why should I share my data to anybody
Yes.
else. So we kept in the structure very clear that the main data with the hospital or the service provider, be it diagnostics or the pharma or the hospital or anybody else, they will be the sole owner of the data. Only data which they would be sharing is the link of the patient, only the link, not the data. So patient can see the link and have the data, have the details of the respective test or the prescription with them. So suppose if you have a hospital, say some hospital, you consulted somebody in Bangalore, and then you went to the Bombay, had a second opinion, and then came to Delhi for say some surgery or something else, and you meanwhile you got tested with some another XYZ diagnostic companies. So you have got a 6 stakeholders where you need to have a data out there. DHM, the way we have planned is that one common application been prepared by the NHA, where using the ABHA ID, you need to log in, and then all the records of yours will be displayed out there of all ABC hospital and XYZ diagnostics. And then based upon your consent, the consent will go to the NHA, the central server, and then they will send it to the respective stakeholders, the diagnostic labs and the hospital, and they will release the respective record of the patient to him, no other data. So that patient has got all the prerogative to keep this data with himself, and release it to the consulting doctor or the hospital or to the laboratory based upon his requirement. If he may choose not to share, he may choose to share for an hour, he may choose to share for a day, he may choose to share for a week or month or so, or perpetual, or he may revoke also. So, and his data is sitting with himself. He can restore this data into the health locker, which was provided by the NHA that time. And otherwise, he can store into his own drive also. He can download it and or can shift it into Google Drive or somewhere, wherever he wants. He can keep that data there also, and can keep on sharing the links to the consulting doctors. So that is how the whole structure was framed. The main challenge which we faced, and main challenge which even in the adoption and implementation currently I feel that people are feeling, is one is we have not created the health exchanges across India. I just to make sure that, because you have given me opportunity to explain this, that where we are failing in implementation of the ABDM across India is, we have, if you want to understand the NDHM or the ABDM, we have created the whole federated structure based upon the FinTech. We have created parallel to the FinTech, the whole health tech created in parallel to the FinTech. The way you have all the banks, we have all the hospitals. You as a customer, you go to the bank and deposit the money. You as a patient here, go to the hospital and give your health information to the hospital. So this is the analogy for the in the both the systems. Then you have a Paytms, you have a Google Pay, you have a Phone Pay, you have a UPI, you have this, that, to transact money from bank to any other bank and to take money to you. Similarly, you have to have a health exchanges across the India, where currently there is only one health exchange which is sitting with the NHA. NHA has planned and given the opportunity to the private corporates to create that type of health exchanges, the way Paytm and PhonePe and the other exchanges have come up to exchange the money across the banks across India. Similarly, if you have a health exchanges across India, you can join those health exchanges, you can transfer your money, you can join any hospital, you can give consent, you can make a one hospital as a mother hospital for your data bank, like, you have your money in a one particular bank, and then you keep on transferring your money from other banks to this bank, and then this become a master bank for your transactions or for your money. Maybe 2-3 banks immaterial. So this is how the whole health tech was prepared based upon in parallel to the fintech. So you can clearly see that where is the gap. We have hospitals, we have banks, we have patients, we have customers out there, we have health information, we have money out there. We have Paytm, PhonePe, and UPI as a financial exchanges. We don't have health exchanges. So that is the one hindrance becoming out there in implementation of this. So this is a one major technical flaw in the system, which if government is thinking, surely somebody bright people, leaders are sitting out there in the ministry, they would be thinking and considering to roll it out across India and giving the opportunity to the corporate to create the health exchanges all out. This particular project will come out very beautifully, and this is a very good project. I have discussed on many international platform that none of the health project has come up in the world as the NDHM has come up. Once these type of health exchanges takes off, all the ABHA holders and all the health service providers and patients will get integrated and help each other, and we'll be having a huge Indian data, healthcare data at a central level. So this is what I see as a hindrance. Second is the adoption of the standards. So to integrate all the data, to have an interoperability of the healthcare data, you need to have a standardized similar data all across the hospitals. So you need to adopt all the standards, be it in the laboratories, you need to follow the laboratory standards, the LOINCs, etc. So LOINC is the laboratory standard where you need to follow all the laboratory tests. Similarly, in the hospital, you need to follow the SNOMED CT or the ICD-11, ICD-10, whatever you are following the global standards. You need to intertrans 7, FHIR R7 protocol. So all hospitals, if they follow all these standards, then data will become interoperable. And anybody can have any data, and patients need not to carry their huge bulky files to the hospital. And hospital need not to create their huge bulky MRD data, which they are archiving due to the compliances for 2 years or 5 years, and for clinical trials, the 10 years. And huge archival is happening out there all across the healthcare industry. So we can get away with the physical archival, with the physical storage, and we'll be having a one good data of the patient where we can provide the good healthcare to the patient. Furthermore, at a national level, we will be able to create a better healthcare strategy to provide a better healthcare outcome across the country. We can create a good healthcare strategy in the region wise, because all the diseases and the epidemic happens regionally. So we can identify that in which region what type of disease is happening. So government can focus on those areas to be a more predictive and rather than a reactive medicine. So those type of things can happen in drug development. You can have an Indian database and centralized Indian database, because today even the pharma industry is mostly dependent on the West data. That is why the medicines which are being given to the Indian masses are coming from the West data. So that is why if you are taking a data, any medicines to treat the diabetic, you are dependent on the data which is dependent on the West. Indian data has got a different standards and different outcomes. So if you will have this type of centralized data, you will have the Indianized outcome of the healthcare system and services.
This is very good, sir. And sir, would you also like to touch upon these all e-health exchanges, which is the missing piece? Like, why are hospitals not being encouraged to
So
build
I see
such
there,
kind of
I see
exchanges?
there is a communication gap, and this is one hospital and one CIO cannot do this type of communication. This type of initiative should need to be initiated by the government and the agents, central nodal agencies like NHA, etc. In recently, I heard, and I've been a part of the committee in the NABH also, where NABH has come out to roll out some plan about this. One good initiative has come up from this type of bodies. So at a central level or a state level, we need to emphasize and come out with this type of policies to create the health exchanges where the data interoperability become easier between the states or among the hospitals and among all the service providers across India.
Sir, related to this data, there is a topic which usually comes up is related to cybersecurity and all these ransomwares. What measures do you think should organization have in place in order to protect against ransomware, data breaches, and other
See, so
emerging cyber threats?
cybersecurity is one area where you need to keep on working all the time. In cybersecurity, there are four-dimensional views you should keep always on. So as conventionally people keep the endpoint security and all the desktop and the system. People keep their mails secure. They put the email security. They keep such type of mails which are encrypted, so mails are secured. So that way, they think that if their system is secure, they are secure. Then it comes to the organization. What organization security guys thinks? They think that I have put the firewall, I am secured. But just by putting the firewall, you are not secure, because today you have all the have smartphones in everybody's hand. So smartphone is connected to your system, and if a smartphone is connected to your system, you are connected not from your desktop, not from your firewall. You are connected out of your environment, within your environment to out of your environment. So you need to make sure that your environment where your employees and data is sitting, you need to make sure that wherever there is that data is going, be it from the mobile phones or through the desktop or through your network line, all these gateways are secured and properly tapped out there, be it through the firewall, through the endpoint security. And then when through the mobile or any other links, if accidentally people are click, because people are impersonating and sending the mails to you, and you are clicking those links, and then that link is taking the data and setting up the link between your system and the external server out there. You need to make sure that the DNS is properly protected and DNS is secured. So all inside out traffic is also secured. Not only desktop is secure, not only gateway level is secured, your inside out all the links are secured by protecting the DNS server. So that's a one piece. Your network is secured. You are watching your network activities. You're watching your mobile activities. You're watching your Wi-Fi traffic. You're watching your network from the inside. Then you need to put something, some eye and some watch from the outside. Like, if somebody is sitting on the satellite watching your country from the security perspective. Similarly, there are many tools which watches your environment from the outside. So you need to implement that type of tool out there, which is watching from the outside that what are the vulnerabilities in your system which you can see from the outside, and what are the holes. So that particular application will keep telling you and letting you know that these are the vulnerabilities which you can keep on fixing from all the ports in any of the system in any of the network, be it your servers, be your switches, be your routers, be it your systems, be it your server. Furthermore, you need to make sure that data at rest is properly encrypted. But in the hospital environment, you need to make sure that, because hospital services are so that if you need some data, if on a click of button, if you're not getting that particular information, the doctors and the nurses get frustrated. They cannot wait. They need to serve the patient first. They can't wait it. So you need to make sure that security is so implemented that your services are not getting impacted, and the latency is not getting introduced because of the security measures. So that's how you need to put all the security measures that latency is not getting impacted and is not impacting the operational aspect of it, the data flow. So you need to archive the data in such a fashion that which is not useful, and which may be, people may wait, the stakeholders may wait for some time to decrypt it and provide it to them. Maybe the radiology reports, the past radiology reports or past diagnostic reports or the past patient data. So those reports can be archived and encrypted into your system so that that information is safe. So that's how you can secure your data. Furthermore, the last piece where which mostly people ignore is the data security when data is in transition. So the most vulnerable part of the data across the world is when data is in transition, because you secure everything, but the moment your data leaves your premises, it flows into the fibers which is going across the road and across parks, across the buildings, where anybody can tap in that particular fiber and pilfer the data. That is what is happening across the globe, where be it the WikiLeaks, take the example of the WikiLeaks, take example of the any countries be involved into it, taking your data from the cables which are going under the sea. So they are putting the traps out there on the fibers, taking the data, decrypting it using the quantum computing, etc., and taking the whole data out. So you need to make sure that all the data which is leaving your premises is enough secured and enough encrypted, which cannot be decrypted easily, Everything is decryptable, but you need to make sure that it is difficult to decrypt it using any damn technology. So these are the security measure. Of course, security is never 100%, but you need to make sure that 99% from your mind it is secure.
And at the same time, sir, while making sure that the data is secure, how can organization also follow these frameworks like RBI, SEBI, IRDAI, and GDPR and all these
See,
compliances
compliances
that
and
have
the
come up?
security, if you say, they go hand in hand. So if you secure, it is like, you are at your home. What you do at your home, when you get out of the home, you lock the main door, assuming that, nobody will walk in from, the thief will not break in your window in the backyard and will not enter it. The day you will see that,
Yes.
there is a thief going on into your colony and apartments, you will put security on the backyard of your windows also. There, you will put that security out.
Yes.
So these are and why you are putting a lock? Because, there is a standards out there that whenever you are going out of your home, you need to put the lock. So similarly, these compliances are those standard rules which says that, should be doing it. So if you follow the compliances, it makes you more secure. So by following the compliances, you not only follow the standards, you make yourself secure and standard, and your data and your systems become interoperable across. So be it GDPR, be it HIPAA or DPDP Act or NABH or NABL, these are all the standards. So they have been framed and been getting mature day by day by considering these type of flaws into the system. So when you see that, these systems, wherever there is any flaw, the another version of these particular compliances become more stringent, be it ISO 27001 or any other. So you need to keep following or adopting these compliances and these certification. So by adopting this certification, you by default become more secure and more compliant to the standards.
And also, sir, there has been a lot of talks around data residency and sovereignty, like with increasing mandates to keep data within specific geographies. What strategies should organizations adopt to ensure that there is a compliance
Yeah.
without
So,
limiting innovation?
earlier days, we were when cloud computing was taking it up, we didn't have much options out India. Most of the data was sitting out of India in the data
Yes.
centers, out of our geography, out of our country. But these days, most of the even international players, be it AWS or Azure or Oracles or Microsoft, everybody has got their data center in India itself also. Furthermore, many very good data centers, many chains and many partners have come up in India also. Those who are not only the tier 3, tier 4 level of data centers, they have set up into Indian geography, which makes sure that your data is sitting within the Indian geography. So, apart from the international player or international application, which we presume to have our data sitting out of the Indian boundaries, you can ask and emphasize and make sure that your data is in local data center. You can have audits, you can have visits out there into the respective data center and make sure your data is sitting within your boundaries, and you have all controls and you have all administrative rights with you, so that you make sure that your data is not out of the boundaries. So that's the one thing. A second is, even though if you don't trust it and your policies, the organizational policy doesn't allow, so you create your own data center within your premises, and you can have your own data center, on-prem data center. You can keep all data out there. Furthermore, if you don't have that much of capability of creating data center within your organization, there are options for having a logged cages into the all shared data centers, where you can put your infrastructure, your cage, your control, everything will be your common services, like air conditioning, power supply, etc., will be of data center, but rest of the controls will be with you, so that you remains rest assured that your data is in your hand, and you are watching and nobody else can touch your data. So these are the options available these days to make sure that your data is in your land and your premises in your control.
And sir, what is the right way to implement encryption and access control,
So as I
especially
told
talking
you
about
earlier that
healthcare?
encryption and there are two questions of this part of this question is, one is the encryption and another is the access rights. So access right is no brainer in any healthcare system or any compliant system of any industry, not only the healthcare itself only alone. The access should be given as from the security protocols. All accesses should be based upon the roles. Based access should be provided. Be it for the administrative roles should be given to only the administrator. The common executive roles should be provided to the executives. Billing to the billing. Finance roles to the finance. HR roles to the HR, and operational roles to the operations, sales roles to the sales, and so on. So all the verticals should have their role-based access so far as the accesses are given. Furthermore, on the backend into your system, you should have the audit logs so that in case of any eventuality, you can go to the system's audit logs and can prove that this particular person who was given the access has misused the access, has given the access to somebody else rather than himself. So you can prove it that this audit, this particular activity was done by this particular user. So that's from the access point of view. So far as the encryption point of view, as I told you earlier, that encryption, when you do the data encryption, it creates a latency into the system to encrypt and to decrypt the data when it is required. So you need to make sure that what type data is required and when to require, and based upon that, you need to desegment the data and encrypt accordingly.
And sir, also, would you like to touch upon this quantum encryption technologies like QRNG and QKD? Do you see quantum safe security becoming a near-term necessity for industries like healthcare and BFSI?
Let me first tell you what is the QRNG. QRNG is nothing but the quantum random number generator. So when you receive the OTP, so QRNG is generally are being used into the random number generator. So when we receive the OTP for any transaction confirmation or anything confirmation, so that particular OTP is 4-digit, 5-digit, 6 digits, and even 8 digits people are using. But those OTPs are easily breakable, and you can create those type of OTP depending upon the once your system are able to watch and monitor those patterns. Based upon the patterns, they can create the another OTP and can send it and fake it. So those type of OTPs can, when you can create it, then you can conceive it also. So when I can conceive that what will be the next OTP coming to you for any transaction, so without asking you the OTP into the next transaction, I can use that particular OTP and fulfill the transaction if I hack in into the system. So that is the flaw into the current OTP system. So to break this thing, to fight with this type of vulnerability, QRNG will be the answer for the future, where quantum random number generator throws the number. So just in a layman's language, I will tell you the how quantum random number gets generated is. If you have you just imagine that, if you have a one room and you have say some windows in the room where you can just throw the ball out there. And out of that window, you are throwing there are say, imagine that on all wall there you have 5 windows into one wall, 5 into 1, 5 into 1. So you have a 20 windows in the room, on the top of room. And from every window you are throwing the ball in the room, tennis ball. And where these balls gets thrown, that is the number which you get it. And every time when you throw, this ball goes and touches to the another spot, all the 20 balls. So this is how, this number gets generated. It is a very, very vague way of explaining the quantum random number generation. So I just thought that, this is how I can just tell you that, this is how quantum system generates the quantum random number, which is very difficult to predict what will be the next number. So that is a quantum random number generator. Then the second question was, you asked about the quantum key distribution, QKD. So QKD is the quantum key distribution. So quantum key distribution is again generated by the quantum random number generator and passed on through the asymmetric and symmetric keys. So when currently when you send the RSA key, which is easily readable through the hacker, they can hack into the pipeline and catch your key and decrypt the key and hack into your system. Where in the quantum key, what happens? See, quantum key is generated using the qubits, the quantums. Actually, this is a polarized proton which travels into the fiber, optical fiber. And these are the polarized photons. The characteristic of these photons are that when you touch it to catch the number, it collapses its configuration. So its configuration get collapses, so you will not be able to get the number which was configured when this photon was configured in a way. So the photon gets configured in a fashion. Again, I'll give you one crude example. You take a tennis ball and put one toothpick into it and move the tennis ball all across. So as many as dimensions you will get out of this tennis ball, that many number of probability you have for a number. So when one particular photon passed through a system, this get polarized, and this polarization becomes a one angle of that particular tennis ball prick which is there. So you can imagine that how many number of permutation combination you will get from one photon to create a one number in comparison to your current on and off the binary number. So current computerization, the numbers are based upon the on and off the binary number. But in future, you will be having a one in place of one binary number. You'll be having that particular tennis ball having a toothpick pricked in and moving all around and having all those numbers. So that many times of computing gonna improve using the quantum computing. But coming back to the quantum key distribution, so that particular proton getting polarized and traveling into the optical fiber, if get touched, loses the polarization, and then your number is gone, and then you can get alert that somebody got hacked in and some man in the middle was there and tried to catch your number. So that is how the quantum key distribution is safe. So whenever you are transmitting your keys, it cannot be trapped or hacked by any of the hacker or the middleman in way. So that is how the so far quantum key distribution is safer. Until unless if there are people, they claim and they say that quantum keys also is hackable if you hack the quantum key distribution box itself. So there are techniques which are also available, but that's very difficult because that is in your premises itself.
That was very nicely explained, sir. I understood it completely. I hope there were professors inside our colleges who could have explained us as much as you have explained us. Sir, we will come to the next topic is around diagnostics and genomics business. And you have overseen these businesses. How do you see technologies like AI-driven pathology, genomics integration, and molecular diagnostics are
So
changing
yes,
patient outcomes?
AI-based implementation into the diagnostics, I've been witnessing this technology for last 10-15 years. Way back in Quest Diagnostics, we were using a technology for histopathology for AI technology. AI-based technology, and we used it into the conventional hematology and biochemistry also. So this gives you a faster outcomes and efficient outcomes, but there are challenges also. I'll give you one example out there in the past when we used it. The these type of technology, when conventional way, when you take a sample and you try to count the platelet count into the blood, you count one single cell in the blood, and then based upon that sample of the count, you multiply it and then predict it that this much or this many platelet counts are there in the patient. So what happens then when pathologist is counting, they are aware that this is a one cell or a two cell or a three cells or three cells clubbed in a one molecule, and they can see the three into one, and they can put up their mind and intelligence out there that this is the number three, not the one. But in the AI based or the artificial intelligence based system, they count it as a one. So that way your platelet count becomes a lesser, which gives a false alarm to the patient that you have a lower platelet count. So there are challenges where these systems are need to be improved, and systems are improving, and AI is getting improved day by day. So with the accurate and appropriate data and these type of mistakes and challenges, which if fed into the AI, the application systems will get improved. So this is a one classical example which I came across, so I gave it to you. But yes, of course, in recent one of the example we saw that one example was held and was shared with us in the Hyderabad based one hospital, where they implemented AI into the radiology, and they came across with one of the patient which was 3 years old patient and was suffering with one chronic disease. He was very normal 3 years back when the radiology report said, and recently he was diagnosed with some cyst developed into his body, and they were surprised that how come his report abruptly became so negative. They fed these reports into the AI system, and AI system predicted 3 years back the report which was given to the patient. In that report itself, AI system predicted that down the line, patient may develop the cyst. AI is so powerful that which best of best radiologist could not predict 3 years back. The AI system could predict 3 years back that particular report that patient may develop the cyst in based upon that report. So we have benefit and edge out there while using the AI to provide a better outcome by using these type of technology where AI can predict it better. To help, I would say that AI should be implemented to enable the clinician and the healthcare practitioner to provide a better efficient outcomes, the patient care, rather than become slaves to them.
And sir, at the last of the podcast, we'd like to understand from you that if you look forward, what are those emerging technologies that you see are the biggest game changers for healthcare
See,
and enterprise
obviously, the
IT?
AI is going to become a day-to-day part of healthcare industry, because AI is being used these days in providing the appointments. AI being used into the to improve the clinical decision support system in the consultation. AI is being used into the diagnostics, into the radiology, into the ICU, into the all the monitoring, where monitoring parameters are being used. There are very new technologies are coming in, wherein new methods are, or very innovative measuring parameters are coming in using the AI. So AI will surely be becoming a, I would say, integral part of healthcare system going forward. Furthermore, virtual reality is going to be another becoming a part for the healthcare system. Digital twin is going to be part of the next 5 years. You'll see the digital twin is also integrating part of the healthcare industry, wherein you have before the heart surgery, you create the a virtual heart and have a surgery out there and see the outcome of it. So these are the future looking forward technology going to become an integral part of the healthcare service providers.
Thank you so much, sir, for taking our time and
Thank you.
very insightful discussion, sir, especially around the national exchange that you talked about and also, talked about the encryption piece. We'll be in touch with you, sir, and extremely grateful that you took out time on a holiday
Thank
to
you,
share
Rishi.
your
Thank you
insights
so
with our
much.
audience. Thank you so much, sir.